NHS will do in sort of skills training, so retraining to try and use grey-haired people in later life for something useful which might be different to what you'd use a bouncy 20-year-old for. So just a thought for you.
Yeah, I think it's something specifically in our area, because we've got a large number of manual labour in there in terms of how the musculoskeletal issues which kind of arise. How do we work with businesses to make sure that they can provide opportunities for people to work for as long as they want? You know, the 64 is a statistical kind of number, but really the aspiration has to be for people to work as long as they feel like they want to work. What can we do to be able
70 sounds like a good
I'll be doing
forever, can you? But
no.
Debate over lunch.
Yeah, but I think it's around what opportunities can businesses provide for that. Yeah. If you've got a good member of staff, how can you make sure that they're able to kind of contribute to your business? Bearing in mind in our area, this tightening of the available labour, companies will have to think about that if they want to continue to operate.
Okay, brilliant. Michelle.
Yeah, brilliant presentation, both of you. Thank you. And I think it's something that's so important. I think we all agree with that. So socio-economic bits of what we're doing for the whole piece around health and well-being and prevention in the NHS. And you mentioned care leavers, which is really interesting, and that I wasn't aware of some of the details, but I read this paper. So I'm going to feed this into a project that we just started from a mental health point of view, because we've got a very, very small amount of money, don't get excited, that is specifically geared to care leavers. And I was going to mention it under the collaborative piece, and we've assigned that to the local authorities, because we think that they're the best route to do. And I think we could maybe put some caveats in to say, well, how is this helping the plans that you've shared today? So I'll take that back with me. The other thing is all our NHS organisations will say, oh, I'm an anchor organisation, tick the box, that's great. I'm not saying that we do, but I think from an ICB point of view, it's really good for us to use that in the strategic commissioning piece to say, well, how are you demonstrating that you are an anchor organisation, given some of the data that you've presented today? And I think that's exactly what the strategic commissioning piece should do. So, for example, when we set up Inspire, we were really clear, which is in Walk Street right in the centre of Hull, that the first cohort of jobs, the first time we ever employed anybody, would be for the local community. And I think we need to be able to demonstrate that. I know other people are doing it, but from an ICB point of view, I think that's really important that we get that. And then the other thing, we do a lot at the front end, not picking up the 70-year-old, not going near the 70-year-old piece, but we do a lot at the moment in relationship to apprenticeships, cadet schemes, trying to do that school leaving type thing. We could do more, but I think we do. But I think what resonated with me is that we don't do a lot of it if people want to change jobs. And because they've got that life experience, and they may have been a manual worker for a long time, musculoskeletal, want to continue work, can't do it. So how can we in the NHS give them a second career at that point? And I don't think we do enough conversations about that. And that might be something that we could start to maybe pilot, have a bit of an experience with, maybe go into some industries and what have you. So we keep them economically active. But we also fill some of our posts with different cohort of people with different life experiences. So that's something that I think we can probably
And I think that's really important. And I think when we were at the skills kind of round table last week, I think whilst I really support that focus on needs, although the new wording was what was it about choosing their options, wasn't it?
Yeah, considering their options.
Considering their options, rather than needs, which is a positive way of kind of describing it. But actually that need to focus beyond that cohort of needs to say that hidden population which actually either want to retrain or are coming into the working life at a later stage with no previous experience at a later age in life. Actually we can't lose sight of the importance of that as well. And I think that's very reflective of our communities. So Anya, and then we're going to Mark.
Yeah.
And then we'll come to you, Andrew, in 2 seconds, Andrew.
Thank you, Chair. Thank you both for taking us through that really, really helpful honesty plans that are in the pack as well. And I know you said there's further work to do in terms of the detail. I was just really interested because a lot of what is presented is the more sort of quantitative data, which is absolutely, understandable. I wondered how much you had or you were planning in terms of some of the more sort of qualitative insight, because I think it would be really interesting to get under the skin of some of these cohorts to understand from their perspective what are the barriers to work or, you know, diversifying into different work, etc. Because I think there will be some quite interesting things that come out there. And I was struck by, I think it was a comment that you made around sort of the migration from universities in the area as an example. And I know from background working in higher education, some of that was actually due to, again, the perceptions of the place and it not necessarily being a dynamic place for some young people to live, as an example. And I wonder how much we know about some of that so we can feed it into those wider partnership plans. Thank you.
Response to that, just in terms of, obviously we've been working very closely with a range of partners, including our local authorities, in terms of trying to kind of get under the hood of some of these kind of the bold figures that we've seen here. So there's a wide range of health partnership work going on in the Bridlington area. So obviously with the index of multiple deprivation came out last week, again the update on that, just showing specifically in our area that coastal regeneration need. And the City of Hull, so you've got almost a kind of inverse L. What's quite good from our point of view is that we seem to be making a bit of a move on Goole, which has traditionally been a kind of an area of great need, but actually the investment which has been able to go into there in terms of Siemens mobility and other places is actually starting to have impacts beyond just that kind of that investment. The trickle down seems to be happening, which is kind of miraculous if you've kind of looked at these sorts of projects in the past. But I think that point in terms of understanding what the specifics are within those areas in terms of being able to design good responses is absolutely key. We've started doing that, we'll be doing more of that, but I think it's not just us ourselves who are looking to kind of understand what the real needs of the communities are. So there's kind of regeneration partnerships there. There's other health type activity going on in some of those areas as well. So we'll be continuing to work with a wide range of partners. So if you've got something to tell us on that, come and tell us it, you know what I mean? We'll feed it into that kind of big evidence base, and hopefully that will help us to design better programmes.
Okay. Tracy, did you want to come back on that as well from your North Yorkshire perspective?
Yeah, just a couple of things actually. To go back to one of the earlier points around that reskilling and upskilling and looking kind of across the whole workforce, I think that's crucial for us. That underutilised piece for us in North Yorkshire is huge around how we encourage people to think about reskilling, upskilling. You know, we have high qualification levels, but you know, we've still got people in lots of low-skilled jobs. There's a lot there to do around what those opportunities look like at whatever age of kind of that career path you are. I think the other thing to mention on the deep dives and research side of it, you're going to test me here, but I think that we have 10 research projects as part of the Trailblazer. So we are there looking at some deep dives into things like rural and coastal inactivity, looking at early retirees and why people are retiring early, doing some work around our young people and those kinds of cohorts, and also some work with our employers to look at what would support them around looking at inclusive recruitment and retention. So we're using the Trailblazer funding to do some of that research so we can then inform things as we kind of move forward on kind of future programmes of development.
Lovely, thank you. So, Mark.
Yeah, I think this is great. This is exactly the sort of thing we should be looking at. There was one particular area I was just interested in, which is people who aren't at work because they are, unwell for various reasons. And clearly, there's quite a strong economic argument as well as a personal benefit for those individuals. Back at work, claiming those benefits, earning their own money, paying taxes, etc. And I just question really: do we have sufficient health economics input to the thinking around this to enable us to think, really think about what we should be doing for these kind of individuals? I'm not even quite sure who I could sort of point that question to, but any thoughts on that?
So health economics question, I love those, because we're all looking at you.
So I think we've got what we've got at this point in time. Is it everything that we need? Probably not. So if anybody's got some insights, like I say, if we've got some insights that you think would be useful to us, please kind of reach out and tell us about it. Obviously, we're starting to talk to the NHS, to the doctor surgeries in terms of that kind of fit note pathway and how we can kind of help to inform some of that to help the GP so they don't have to be constantly doing all of the fit notes. We can get some support. I think the approach that you're talking is similar to the approach we're taking in terms of that kind of people-centred approach. So if we can kind of get some support for the GPs, that means that they don't have to have that kind of fit note. We can do something else to actually get them into kind of work with that's useful. But in terms of the health economics angle of It's a Rumsfeld thing, isn't it? I think I know some bits of it, but I'm sure there's whole chunks of stuff that I don't understand. So if you've got something that you want to help me with,
Well, I think there are universities around here who are quite into all of this,
Yeah.
and it might be useful to
Yeah.
engage with. Just, I mean,
So have a contact, that'd be really
Yeah,
useful.
yeah.
I'd be really
It's a conversation to pick up, isn't it? I'm going to bring Therese before I go to Andrew.
Yeah, because I just wondered, because I think, Mark, are you coming at this from a return on investment effectively?
I
So
was,
being
I'm
able to
thinking,
quantify that if you addressed that, you know, that
Say that.
whatever cohort that is, that you would actually, you know, the income generation, the economic generation, should I say, would be X, and sort of getting that
Yeah,
figure
I'm
around.
coming from the perspective of
Yeah.
this is the right thing to do for people
Yeah.
anyway.
Yeah.
But is there an investment that should be made in certain individuals because we believe the economic return would
Yeah.
also be great.
Yeah.
And
Yeah.
That's what
and what
that's
should
what-
we do? So that's
Yeah.
exactly what.
So in terms of that, there's some national figures. Whether we've got any local figures is a good point. So I think we could
Yeah.
probably do some more stuff in
We're
terms of.
starting something, maybe something that is part of the plan moving forward. I think it's
Yeah,
great,
yeah.
isn't it? Yeah. So Louise and then Andrew, because I'm conscious of time, we need to move on to money and performance.
Yeah, I mean, just to acknowledge the work that's gone on, even just on the trailblazer element of this. This has been rather rapid, hasn't it, Tracy? Certainly from our experience in North Yorkshire and York, and partners have really had to pull together in order to get a credible plan, hopefully, that we will absolutely deliver against. And of course, we didn't know if there was a second year of funding, so I think it's right, Tracy, to say that there is, and we're trying to work on what that looks like as you've described in the plan. I think because this is not all just new, when we're building on things that have happened before, having it in one plan and in one place is really helpful. Because I think sometimes people use language interchangeably, talking about Trailblazer, Get Britain Working, the work that we already had ongoing, our economic plans. So just having it crystallised for us in terms of what we're talking about, and then being able to see what the impact has been on the various parts of this are key. But it's not just a 1 to 2 year thing, is it? It's clearly a very long-term plan that we need to just keep at, and of course good public health means that you've got good work, high quality work, that you're feeling supported in and psychologically safe at work. So really pleased to see this, Tracy, and I know we've been on the journey with you on Trailblazer and we'll continue to do so from a North Yorkshire Council point of view.
Thank you. And this is connecting so much what we've talked about today. Superbly constructed agenda. Tracy, do you want anything you want to say before we go to Andrew? Sure, let's go to Andrew, and then we'll come to Tracy, and then Jane, I'm going to ask you to pull this together and tell us what we need to do next with this, because clearly there's an energy around the board around this, which is something we need to do something with. Andrew.
Yeah, sorry, Jason, I'll be very quick, which is unusual, but I don't disagree with any of that. I just really hope that we don't overlook. We can create inequalities with an approach that maybe just focuses in one type of direction.
Yeah.
And what I'm talking about is the vulnerable people within our society and things like that. How do we create an environment within communities that links to our community-based health approaches, that allows people access to jobs, but also supports like the SEND agenda and all that? I mean, in Hull at the moment, I think there's probably very few big companies as us, the local authority, that take young people with with multiple issues and give them a chance. And I wouldn't class them as economically not bringing something or adding value in pounds, but also in value. And that starts to create community cohesion, to be honest.
Yeah.
Because actually people see the worth of public sector. At the moment, people don't see our worth, and we're missing a trick. So what are we going to do about making that a reality?
I think it's a really powerful point. I kind of,
Sorry.
Go on, no, really quick, I'll let you sneak in before I go to Jane.
Yeah, it was just because it's quite adult focus, and I thought that was really good in terms of what we're trying to do, and it's really good to hear care leavers are part of that. I guess my ask was, where are we involving the voice of children, young people in this space? Because as adults, we can say this is what you need, and it's about the comms on it, and they are absolutely brilliant at pulling together comms and the communication to their peers about what we want to do. My worry is, having been in East Riding, a lot of our young people move out, and then people come back as families. We need to retain our young people. And just in terms of the SEND agenda, we're working with Siemens. They take on our children with special educational needs and disabilities. It's Care Leavers Month right now. And there is no comms on that in terms of our anchor institutions saying Why don't you come and trial with us? Apprenticeships, work experience, there's lots of things that we potentially could be doing for our young people, but we need them to help us to get to that, to actually shape that. But I thought that was a really good presentation, and it's really positive to hear.
Did you just want to really quickly pick up on that whole thing around adoption inclusion, because it was a really key point that came out of the round table around actually the absence of trudging people shaping this agenda, and I think, so if you could just touch on that really quickly, and then we'll come up with some next steps, because inevitably you will be coming back.
Yeah.
So I think the thing to say is that, as alluded to, we had a round table last week. We had one young person there. The retort was, well, this is all very nice having one good young person here, but are they really going to be able to represent our views? And the answer is obviously no to that. One thing that I will say is that the Mayor for Hull and East Yorkshire is deeply committed to young people's issues, their resilience, their mental health. That's something that he's laid out very clearly within the game plan. So again, we're a young organisation. We're starting to get kind of structures in place which are going to allow us to be more in some of these spaces that we want to be in. So just bear with us. But I think the good thing from the Mayor's point of view is he absolutely sees this kind of from the sense of his kind of mission, if you like, in terms of his time as the Mayor for this area, and he'll be wanting us, he'll be pushing everybody within that organisation to do that.
Okay, Tracy, anything else you want to say about that as well? Because I know that's something that's part of your plan as well, isn't it?
But it's a little difficult to hear. Is it possible to just summarise the
So we were talking about opportunities for the voice, particularly of children and people, to be part of this whole design and deliver kind of phase. So what's that voice of lived experience that kind of flows through this?
Yeah, I think there's a couple of things there to pick up on. I mean, we were very clear in what the work we're doing on Trailblaze, but also in the plan that there is that preventative piece that's really important about how we make sure that you know we are dealing with those issues before they get more severe. But I think the other thing to mention is that as part of the Trailblazer in particular, we have started looking at an engagement kind of framework, recognising that we need those voices around lived experience, whatever age group, but we need that to be coming through in terms of informing how we develop things. But I think it's already been mentioned that the plan in many respects, it is that one point of bringing it all together. We're very much at the start of this journey. There are so many things we need to be looking at, particularly in terms of how we do things and what those structures are. It's going to be key how we keep this momentum going, though, in terms of moving forward on those actions. So I think for us, that detailed delivery plan is where we get the opportunity to bring a lot of this together and actually look at some of the how we're going to do things.
And I suppose, just to finish something off, actually the people around this table, those cohorts of people working in the NHS are a really important link to actually some of that experience and engagement, and actually it's those initiatives, I know that Andrew's organisation runs, those initiatives that Michelle has kind of touched on already, the stuff that's happening kind of within local authorities. Actually, this to me feels like an opportunity to say, how do we make best use of our assets? How do we understand what we've got? And actually some of the investment is in some of the stuff around the gap stuff, and I think we're making a really good start. So Jane, putting this together,
yeah, I'll keep it relatively
give
brief.
us some next steps.
The first bit to say is thank you to Tracy and to Andrew. I think that was a really good quality start of a conversation for us, and I think you're right that this will come back. In practical terms, the ICB is a signatory along with others to the Get Britain working plans, and you're all in the process, I think, of just finalising them. So for us, that'll be you, Teresa, and Jason that are going to sign those off as they come in, which is imminent, I think, isn't it?
Yeah.
From each of you, and I think that's the same for Claire. I think one of the things that I see as really valuable in this is it ramps up the focus on good work. And I think even in the population health space, we've really struggled to get a real focus on good work as one of the health inequality levers that we can pull. So I personally really welcome and value that. So it's brought everything together, Louise, as you've said, but it also allows us to look at all the different determinants, doesn't it, and make sure that we've got a focus on those. So it's really good to see it all in one place, but also good to know that we're going to be focusing on how big a difference good work can be, and actually as anchor institutions, our own charters around good work and how we implement that in our organisations being so key. So I think the practical things we need to do, and then as the plans, both of you have said, and I think the same is true for Greater Lincolnshire, that this is your original plan and that there will be much more to come and much more engagement to come ready for version 2. So I think we would welcome that then at the board for further discussion and debate around the content of that, and behind the scenes, away from board meetings, continue to support our 3 mayoral combined authorities with that.
So we'll get a further kind of update on the forward plan. From the board's point of view, you know, supporting what you've heard today in terms of the plans, and Teresa and I, on behalf of the ICB, signing the kind of the plans. And I kind of think I'm thinking around all of the work that we've done as a wider partnership around skills within that breakthrough space, Jane, in terms of all the stuff around inclusive health and careers, where actually this has given us a running start, which actually I think is really useful in helping shape and deliver and drive these plans. So back to legacy, I think we've got a really good legacy in terms of how we've worked as a system and all parts of our system, mental health, community, primary care, BCSE, acute, you know, community, all those people together. Actually, we've actually started to do this work, and it's good to be able to kind of share this with others in developing this plan. So thank you very much for your time this morning, and thank you for your plans. And thank you, Tracy, for dining in, and hopefully you can hear at least some of that.
Yeah.
Brilliant.
Okay. Thanks very much.
Thank you.
Bye.
You can stay for the rest of the meeting if you want, Andy.
Very kind invite.
With sure that's anything. Super, thank you. Thank you. Apologies, Simon, we're running slightly late. We've had some technical challenges today. So we are being filmed by a mobile phone at the moment. So just don't let it put you off. A handheld mobile phone. Do you want 2 seconds, Mark, just to put your wrist down?
Yeah.
I'm okay. I'm all right.
Okay,
Yeah,
no.
I'm becoming increasingly shaky, but I think I've got a few minutes left in me.
Yeah. Although I have been told today that we've got a number of nurses in the room.
It's reassuring.
And doctors. The nurses I got told off before.
Nurses will be more useful.
Just take 2 minutes put your hands down for 2 minutes while people